I'm Ann Fisher. I'm the Executive Director of the AIDS Legal Council of Chicago. I've been here now for 12 years. We represent people with HIV and AIDS and, not surprisingly, deal with a lot of problems people have with their insurance companies. But I want to speak also as a small employer. We have about a dozen employees here, and it's terrible as a small employer in the health insurance market. One of the things that I've realized is that there is a financial incentive for employers to discriminate against people with high health care costs, because your rates are going to be directly related to your claims history. And so I see this as an advocate that people may be fired or not hired because the employer is afraid they're going to cost them too much. And I see it as an employer where we need to get a new insurance policy, and all my staff have to fill out information on all their health conditions. And then depending on what they say, our rate's going to be set. And it's also terrible that as a small employer we have such little choice. We were with a cooperative plan that folded, as many of those do. And so we went to the private market. We went to an agent, a lovely agent. She was only able to find 2 plans for us. And the first one that we signed up for, it turns out it provided no mental health coverage. 0 coverage for serious mental illness. Now, I don't happen to have, I don't think, any clients with serious mental illness, but as an employer, in an advocacy field who cares about health care, I'm not going to give my employees a policy that doesn't cover mental illness. And so it's just so hard for us to try to come up with an affordable plan, and that's why it would be so great for small employers to have more choice, including a public option, where we really could select a plan that works for us and works for our employees. I also get really angry at people who suggest that the solution to healthcare costs is somehow we give consumers more choice, and they're somehow supposed to go off and figure out, how much an appendectomy costs at hospital A versus hospital B. The notion that our healthcare costs are high because we're all running around having unnecessary healthcare is nuts to me. Healthcare costs are high because some people have expensive healthcare conditions. It's not that people with HIV do not run up big bills because they're going to expensive doctors. It's because the HIV drugs are covered by patents, and they cost a fortune. So it's really, it's just terrible that our choices are so limited. I also hate it when I see people who come in who think they have health insurance, and it turns out they really don't. We had a guy once, and Justin and I could tell stories about this all day, who came in with a $60,000 hospital bill. But he had insurance. He worked for a huge employer. He thought he had insurance. I opened the summary plan description, and it looked like a regular insurance policy, outpatient, inpatient, pharmacy, all that kind of stuff. But his outpatient was capped at $1,500 a year. His pharmacy was capped at $750 a year. And his inpatient was $200 a day. It didn't cover your surgeon, it didn't cover any labs in the hospital, it didn't cover any medicine in the hospital. So no surprise, he'd been in the hospital 5 days, they'd paid their $1,000, and that was the end of it, and he was responsible for the $60,000 bill. So it's just the healthcare system is broken. The healthcare system is broken for people with severe health conditions, it's broken for small employers, it's broken for the poor, it's broken for the rich. We've got to have real health care reform. We're overdue. We see it every day here. It's got to happen now.